So, welcome everybody to today's topic. Like I said, my name is Shani. I'm one of the counselors, addiction counselors at Changes Rehab Center. I just want to share my screen. Seeing as it is the holidays, I thought perhaps we could discuss relapse and how that pertains to the holidays, over Christmas and New Year's and what to expect and what we can do. So I hope this really benefits each and every one of you. So before we start, I just wanted to read a little insert. So this is a fictitious story, which is usually used for educational purposes and to help teach families and loved ones. It's also a great example, which I think a lot of people could relate to as to what happens over Christmas. It's a short little story. So this is the story of the mother that tries to buy a perfect family on Christmas. This is a story that so many people can relate with because it happens so often. One of the most common ways that human beings try to make up for their own mistakes and shortcomings is with gifts. You hear stories about absentee fathers and mothers that spoil their children with gifts to make up for the fact that they are always working and never around. But this is just the most blatant situational example. In complex family systems, gifts can be used as weapons, as leverage, as blackmail, or even used to assert one's dominance over another. Christmas is centered around gift giving, a very noble deed that has the ability to bring cheer. However, in some situations, the act can cause more migraines than merit. That is the case with mother number one, who, in the midst of a family financial crisis and several members accused of stealing money for drugs, has decided that buying everyone very expensive Christmas gifts on a credit card will make her into the hero and allow her family to forgive her over Christmas. Now, just as a short intro, I mean, there's no dire information there, but just something to consider. We have our clients at the moment sitting in treatment, and Christmas is coming, and New Year's is coming, and we have a lot of families asking whether or not they can visit their clients. Can they come home? Can they come, for a couple of hours and so forth? And all of these situations, like deem some sort of understanding and just trying to see what could happen. We need to play the movie through. We're not just concerned about relapse. We're concerned about the emotional well-being of our clients. It's not necessarily no, but perhaps we need to consider it's not now. But we're not here to convince you of any decisions you need to make in the upcoming months or weeks, just to provide you with some information so that you could make an informed decision around what to do next in the upcoming weeks with your loved ones. So let's get started. The first thing that is very important when it comes to relapse prevention is that we need to understand what recovery actually means. So recovery is not necessarily abstinence. So we find that clients come into treatment and the hope is that, they just get clean, they get sober. And so long as they stop using and they stop drinking, then their behavior will come right. Unfortunately, that's not necessarily the case. So abstinence is just one half of the problem. The other half is behavioral change. So if the clients do not adopt some sort of behavioral change, what inevitably happens is they go through an emotional relapse, a mental relapse, and inevitably a physical relapse, which we'll get to later. But in order for us to understand what recovery actually means, recovery from addiction means abstinence plus behavioral change. And, 21 days in treatment is fantastic when it comes to abstinence, but it's a very short period of time when it comes to behavioral change. So often we do encourage families to extend treatment options, not just for abstinence purposes, but to elicit, like proper behavioral change, which takes time. Some of these behaviors and programming has been adopted over years, some of them all the way from their childhood. To expect that kind of change in a couple of weeks, is not necessarily realistic. So that's the first thing. So relapse does not happen when the addict takes the first drug or drink. I know it seems very logical that if they pick up the drink or they pick up the drug, that's a relapse. In many ways, yes, it is. But what's important to understand is that a relapse is a process and it starts long before the physical use. The relapse process causes the addict to feel pain and discomfort when not using. This pain and discomfort can become so bad that the addict becomes unable to live normally when not using. So in AA, we call this the dry drunk syndrome. So this is someone who has cleaned up and has stopped drinking and has stopped using, but hasn't necessarily changed their behavior. So what happens is essentially is if they don't change their behavior and they put down the drink and the drug, all that really happens is they have to go back into their lives, deal with their problems with dysfunctional coping mechanisms. And what happens is the negative feelings come back. And so long as those negative feelings come back, the only way they really know how to deal with them is to use. So we're fighting the before and after, not necessarily just the drugs. So that's very important to understand, is that the emotional pain comes after they stop. Yes, emotional pain leads to them using, but when they stop, you can imagine the crutch is taken away, the solution is taken away, the only coping mechanism is taken away. So you can expect the feelings to go up, shame and guilt and all of these types of feelings that really hurt them and cause great discomfort. And these are the feelings that usually lead to a relapse if they're not managed appropriately. I think what's important also to discuss is what actually constitutes a relapse. So, naturally, if your loved one goes back to their drug of choice, the DOC, that constitutes a relapse. Of course, they come into treatment to stop drinking, and the moment they leave, if they pick up a drink, that is what we call a relapse. Another thing that constitutes a relapse is if, say, your loved one comes in for, let's say, marijuana. They come in for marijuana and then they go out and then they decide, well, I never had an issue with alcohol, and then they start drinking. So that also constitutes a relapse. Just because it's not their drug of choice or the drug they came into treatment for, that doesn't necessarily mean that if they use another drug or another mood and mind altering substance, that that's not a relapse. There are some controversial discussions around caffeine being constituting a relapse, but I do think it's important to understand that there's caffeine in certain medications. So especially with flu medications, the caffeine and the pseudoephedrine, especially together, if your loved one is taking these types of medications, that constitutes a relapse as well, because it acts as a mood and mind altering substance. So here are a list of different substances. I know these words are really big and not necessarily to write them down, but I think what's important is, there's four main ones that you should look out for, other than your typical illicit drugs. So the meth and the cocaine, the alcohol. Besides the typical drugs, your loved ones need to avoid moving forward alcohol in your medications, so like your cough mixtures, or alcohol in foods. Anything that could contain alcohol is something that would constitute a relapse. The other one is benzos. Benzos is the short word for sleeping tablets. Opioids is the short version for painkillers, and codeine, which comes in a lot of your cough mixtures. So there are obviously different types, but to make sure that when your loved ones come out, that these are things that they avoid. One of the things that your loved ones can do is they can go to a pharmacy and they can flag themselves. So what that means is they go to the pharmacist and they say, please flag me for these various substances. And then any pharmacy they go to, if they try to get that type of medication, it will come up on the screen and the pharmacist will say, excuse me, you've been flagged. Very similar to gamblers who basically announce that at casinos, they flag themselves at casinos. So that's something that I think all families need to consider, is that if, not even over the festive season, but if you notice your loved one cross-addicting from one to the other, they went in for marijuana and they have a bit of a cold and they come home with cough mixture, alarm bells should be going off. Any mood and mind altering substance can lead to a relapse. So if we look at why does relapse rates get worse over the holidays? Things really do get worse for addicts and their families during the holiday season. This is because addiction is a living, breathing system that not only embeds itself into the life of the addict, but into the lives of everyone around them. The holidays are simply an emotional time of year when everything gets busier and people pay more attention to their past, their present, their future. Christmas time causes us to evaluate our lives and what we have done and accomplished in the past year. For those who are not happy with what they see, Christmas can be an ugly reminder of their own shortcomings and failures. Things can get even uglier when someone who is not happy with their current situation gets in a room with family and friends who are successful and positive about their situation. So one of the main contributing factors for the holiday season being quite triggering is the fact that it's a reflective time. It's not the only reason, but it's one of the reasons to consider is if your loved one has just come out of treatment and everyone's sitting around the table and they're celebrating with a glass of wine. I mean, COVID has been horrendous. I'm sure if we all made it to Christmas, we're going to want to celebrate that we just made it to Christmas. But can you imagine your loved one sitting there evaluating the last, I don't know, 30 days where their mom and their dad and their brother have had a relationship for the past 30 days and they're just so happy that their family has come back together and my precious son has just, completed treatment and yay, everyone's happy. I think we minimize how the client must be feeling, the emotional stress and angst that comes with reflecting on what the last 30 days of their life has been and what the last year of their life has been. Hasn't necessarily been pretty. And that can really cause emotional strain with our clients and with your loved ones. One of the other things, some other reasons to consider, the atmosphere and excitement surrounding Christmas reinforces the feelings of low self-esteem and low self-worth. It can become very difficult for people to deal with the anxiety caused by the financial and consumer pressures of the festive season. So you can imagine, like that story I shared when we started, maybe a mom or a dad or a loved one who comes out of treatment remorseful, very remorseful, and is very anxious to say sorry and to look for forgiveness. And just wants to fix things. The anxiety caused by not only the financial, now we're going to go use our credit cards, to possibly just, it's not only buying gifts, but the financial pressure that comes around Christmas time after having, a couple of weeks in treatment. So there's that anxiety that comes. Another one is difficult family relationship situations can be exacerbated at this time of year. Financial strain caused by overspending, the pressure to be upbeat and act as the perfect host. Not only the host, but the pressure to pretend like everything's okay. Let's leave the past in the past, love. You've gone to treatment, everything is fine. We're going to look forward to the new year. We're going to make New Year's resolutions. Addict or an alcoholic in recovery, just the mere thought of the future is anxiety provoking. They already have fears of the unknown. They've never lived a life in recovery. They're already scared. They don't know what to expect. A lot of our clients have control issues and perfectionistic tendencies, and they comply and they go through the motions. These are all addict behaviors that lead, to dysfunctional reactions. Again, remember that behavioral change that needs to come. If one of our clients are feeling threatened or they're feeling anxious, they're going to resort to old coping mechanisms if they haven't had extended treatment to cope with their feelings, because they don't have alcohol and they don't have drugs. So they're going to rely on coping mechanisms that got them through the first time, which might be things like dishonesty, manipulation, avoidance, isolation, perfectionism, overcompensating, pretending. All of these kinds of behaviors are just asking for a client to be triggered. and just being the festive season that comes naturally with the terrain. Spending extended periods with relatives. Not all our clients have functional relationships with their loved ones. There's a lot of resentment, there's a lot of hurt. Some of these relationships haven't been mended yet. And to be in that environment for extended periods of time can bring up a lot of shame and a lot of guilt and a lot of remorse. Again, the emotional intensity really plays a role in relapse. And again, we're going to speak about that in a moment. Excuse me. The last one that we considered is the need for confidence in social situations, such as office Christmas parties. So this isn't necessarily just about Christmas Day, but can you imagine your loved ones who feel obligated to go to their Christmas party because their CEO asked them to? They have high statured jobs where they're going to have to show face. These environments are exceptionally triggering for our clients. To be surrounded by their colleagues celebrating the end of the year, clinging champagne bottles, just the mere sound of that could trigger them. So to keep them safe, we really need to consider some of these reasons above and beyond our personal needs to have them home. Just some stats just to inform what I'm trying to explain to you. Less than 20% of patients who receive treatment for alcoholism remain. While the first years can be the hardest, the relapse rate goes down over time. Why that is important is because that statistic has got nothing to do with what time of year it is. Whether it be December, January, June, August, it doesn't matter, okay? 20% of patients who receive treatment for alcoholism remain alcohol-free for an entire year. However, while the first years can be the hardest, the relapse rate goes down over time. So around 1 out of 3 of people who are sober for less than a year will stay that way. But if you can get to a year of sobriety, the relapse rate falls to less than half. Also, according to the same study, if you get the 5-year sobriety mark, your chances of relapsing are less than 15%. Another study, the American Addiction Center, found in 2019, over the Christmas period, they did a study of about 1,200 people in recovery. They sent out questionnaires over the Christmas period, and they wanted to find out how much it influences relapse rates. So obviously, it's very difficult to kind of quantify what a relapse could be because of the emotional relapse, the mental relapse, and the physical. So what they looked at was depression and anxiety, which are really comorbid conditions that go with addiction use. There's a great relationship and link between addiction, depression, and anxiety. So you can imagine if depression goes up and anxiety goes up, the addict can get far more sick, if I can put it that way. So what the study found over the Christmas period, that these clients or these people in recovery reported 25% higher levels of depression over the Christmas period. 62% of them reported higher levels, moderate anxiety, but higher levels of anxiety. 62% of these recovering addicts and alcoholics reported an increase in anxiety. 94% of these recovering people reported feeling overwhelmingly or moderately stressed during the holidays. So that leaves 6% who didn't feel that way, which is a staggering statistic. And the one that, and they looked at the readmission rates during the month of January. In other words, once a client has gone into treatment, they come out between December and January, they looked at how many of those clients got readmitted into treatment due to relapsing. They found that over the Christmas period in 2019, there was 150% increase in readmission rates during the month of January. So I really hope that just informs what we're trying to illustrate to families over the Christmas time, is that there's nearly 150% increase in clients going out and coming back in January. Whereas if you stayed longer in treatment, your chances are higher. So it's not necessarily about the willingness of the client. Studies have shown that the longer they're in treatment, the higher their success rate. And we're obviously speaking of uninterrupted treatment. If we can get them through their first year, 1 out of 3 people, as you can see, the relapse rate falls less than half. So length of stay is really, really important. So I'm not going to get too much into this, but I just wanted to illustrate how and why this is so important is because the stages of relapse, again, don't worry or don't really consider what month, January, February, March, the stages of relapse are the same. So the first point of call is that the client will have an emotional relapse. So their emotions become increasingly overwhelming, like I explained earlier. And once they go through an emotional relapse, if they don't intervene at that point and practice their techniques that we are teaching them about self-care, emotional well-being, and so forth, if they don't interrupt that boulder, so to speak, it rolls into a mental relapse, which is what we know is preoccupation, is obsession, all their reasons for wanting to stop and to not use and drink start to go out the window. They start to obsess about what their lives could have been like. They obsess about what their life can be like. Why can't they just have one more? And they find that the insanity returns and the obsession returns. And if they don't intervene at that point, that usually leads to a physical relapse. Why is this important? Because the likelihood of the E boulder, the emotional relapse boulder, spiking over the holiday period is very, very likely. You're asking your loved ones to move straight out of treatment, practice their skills almost immediately, and almost hold this emotional boulder up. It's almost like they've just taken their first steps in recovery, like a toddler, perhaps like a 2-year-old who's starting to walk. And to expect a 2-year-old to hold this incredibly heavy boulder right from the onset, straight out of treatment, it's very difficult for them. We are giving them skills, but they still need time to practice them, and a slow integration where they have a safe environment, where there's less stress and less emotional intensity is obviously better. It gives them more of a chance to hold the boulder up. But you can imagine over Christmas time, it could possibly feel like a gigantic mountain to climb, and all we're really asking our clients to do at this point is to just get to the first base camp, not the whole entire mountain. So to put it in layman's terms, baby steps. Baby steps is what's important. Something for families to consider if your loved one does go home. Again, we're not here to try and get you to change any of your decisions, but just something to consider, that if your loved one comes home for whatever reason, circumstances, financial, whatever the case might be, some things that you might want to consider looking out for. These are the 37 warning signs of relapse. There are quite a few there, so I'm just going to pick a few. So ones that are quite obvious is easily angered, conscious lying, overwhelming loneliness, periods of deep depression, loss of daily structure is very important. Also where they have impulsive behavior, where you'll see their self-care starts to almost decrease. So if you see your loved one not necessarily making their bed, brushing their teeth, taking a shower, that's one of the quickest ways to see that your loved one is starting to go, slide down again. If they believe I'll never use again, daydreaming, wishful thinking, feelings that nothing can be solved, feelings of powerlessness, thoughts of social using, trying to convince you that they never had a drinking problem, they only had a drug problem. So they're allowed to drink. That's also quite a great warning sign, and you'd be surprised how often that happens. So this is quite a few of them if you want to read them. A lot of the things, one of the most important things also to consider is when they start to take a back step on their fellowship meetings. So they were going to meetings, connecting with their sponsor, doing step work, and you'll find that they'll start making excuses, some of them, and go, I don't really feel like a meeting. I did one yesterday. That kind of behavior where they put their recovery on the back burn, or they make excuses or justifications to not connect with their program and to opt out of their commitments, is also quite a great warning sign. So just things to consider. But what can we do is very important. Remember, we don't necessarily want to enable our loved ones. We don't want to take responsibility for them. We need to detach with love, detach from the situation. But there are a few things that we can do at this point. So one of them is we need to start by learning about mental health disorders, addiction, and integrated treatment. It's very, very important. The more information you have, the more informed your decisions can be. And one of the starting points is to educate yourself around addiction and around mental health disorders, and especially how they relate to each other. You might find that your loved one speaks often that it's their bipolar that caused this. I'm having a high, I'm having a low, I'm manic, I'm depressed. In very similar language, not to say that it's not bipolar, of course it could be. But remember, if they have bipolar or a dual diagnosis, they have another mental disorder, which is substance use disorder. And these highs and these lows could also be attributed to the addict acting on character defects or their disease kicking in. So to not excuse one for the other, and to educate and inform yourselves on which one is which, also helps a lot for you to understand what's going on, especially about the disease of addiction. The second thing you can do is help your loved one follow all treatment recommendations. So you'll notice that when your loved one leaves treatment, you get a call from myself or one of the other counselors. We have family sessions and we discuss things like extended care. We discuss the implementation of a 90-90, 90 meetings in 90 days. All of these recommendations, as well as the ones from the psychiatrist, encouraging your loved ones to take their medication as prescribed, to make sure that they are taking their medication when they're supposed to be taking it, and keeping in mind that the moment they take a drug or a drink, it really impacts psychiatric medication in a terribly, terribly bad way. I always say to my clients that if you're going to drink and take some sort of bipolar medication, you might as well just eat Smarties because they cancel each other out. So if you're going to let your loved one, okay, so you're not doing weed and you're not doing cocaine, that's okay, but you never had a drinking problem. Please, please, please consider that their psychiatric medication is severely impacted and impeded if they're going to take substances as well. That includes alcohol. Complete abstinence plus behavioral change equals recovery. Abstinence is very important as much as behavioral change, So you can encourage and help them follow all treatment recommendations, see through their exit strategy, see through their treatment. So if they committed to 6 months, to hold them accountable to that. To allow your loved ones to come out 2 months earlier is already just facilitating this idea that they don't have to finish something that they started. So treatment recommendations are important and they're well thought through, and they are bounced off many of our professionals there at Changes, from our OT to our psychiatrist to our head of treatment. Collectively, there's probably more than 35 years of experience. And these recommendations are not made lightly. They are made in the best interest of your loved one. And they're also embedded in research, like some of the research I've showed you about extended care. So to encourage them to follow through is very important. Like I said, encourage total abstinence from alcohol and other drugs. Help your loved one build coping skills. How can you do this? One of the easiest ways is just be there to listen, talk, and help your loved one process stressful experiences. Not necessarily rescue them, but listening to them goes a very, very long way. And expressing your concern is also very helpful. Another one is you can reduce family friction and provide social support, encourage participation in support peer groups. What I mean by this is encourage participation with Narcotics Anonymous, Alcoholics Anonymous, Gamblers Anonymous, whatever their affliction is, to encourage them to go to 90 meetings in 90 days. Know the signs of relapse. Extend treatment options to up to a year, if at all possible, because the research shows that it has a greater success rate than any willingness of a client walking in. And number 9, avoid positive reinforcement. So, for example, if you go to treatment, I'll get you a car. If you go to treatment, I'll pay for your apartment. When you come out of treatment, I'll make sure that I'll pay off your debt. You know, having these barters and transactional relationships with clients, you know, really causes dysfunctional relationships from the very, very onset. Clients need to understand that there are consequences to their addiction. And without actually experiencing their actual consequences, they don't necessarily learn. They need to have an emotional experience in order to retain the memory. If they're not having an emotional experience related to the consequence, they're never going to remember it. So the consequences, as horrible as they are, they need to feel them. And for us to rescue them and reward them almost robs the appropriate emotional experience that goes with consequences. So I'm just going to end off on this sentence, and just want to open up discussion, and I'll allow Cheryl or Dr. Tia or anybody to answer questions if you have. When we come to this time of year, very, very simply put, we often hear loved ones and family members express in a very simple way, don't worry, he or she will be with us over the holidays. We won't let them out of our sight. I just wanted to end on that to try and open conversation around any of the questions you might have, concerns you might have about addiction over the holidays. Because like I said right in the beginning, addiction does not take a holiday. Addiction doesn't care what time of the year it is. It doesn't discriminate. It doesn't stop just because it is the 25th of December or the 1st of January. The emotional relapse, the mental relapse, the physical relapse is very, very likely depending on the intensity of the emotion. We can only just concur that over these holidays, the emotions are higher and intenser than normal.